Hi, I'm Chloe Fox, and I'm here to introduce you today to BOB.health, which is the national learning platform that the NHS deserves. Our rally cry is simple. You made a change, share your solution. At its heart, BOB is all about NHS staff helping each other. So when starting an NHS project, big or small, NHS staff can find it really hard to discover the experience and practice of other people who've delivered something similar. When you're looking to start something, you might go to the person who's been there for, say, 9 years. They have that institutional memory. You say, have we done something like this before? And they'll dig out the information needed, and then away you go. But our BOB is available UK-wide and at the click of a button. So why is experience sharing so hard in practice? Well, from our 4 years of research, we've uncovered a number of reasons. Firstly, people are really busy and there's little incentive to find the time to share. Secondly, practice and experience is published haphazardly and it can be really hard to find. Either it's behind paywalls or it's on the 10th page of Google. Next is that published write-ups can lack that how-to guidance needed for somebody else to do something similar. They can be quite superficial in nature and maybe geared more towards maybe an award entry, for example. Finally, individuals move on and that learning gets lost and taken with them. So what does motivate someone to share? Well, from our research, we found that altruism, no surprise, is a big one. There are some really good people in the NHS, as we've seen over the past few months more than ever. Next, people do want recognition for doing a good job. It's always nice to have a pat on the back and be given a bit of kudos if you've done something well. Next, career progression, being able to profile the work that you've done over the past months or years can really help you to get a boost in your career. Next is clinical revalidation and CPD. We know there are requirements for things like reflective learning pieces. Well, sharing a story can help you support that. The other one that actually maybe surprised us is as being a really key one is that there's a desire to see ripple effect of your work elsewhere. So if you're up in Newcastle, for example, and you've done a great project and you see then that somebody in Truro replicates that, can give you a really, really big boost. Ultimately, it's all about being a small part of making the system better. So we're creating a community of adoption. So a bit of an intro into BOB's model. BOB is completely free for the NHS to use, and that's because we've got a two-sided model. So on one side, there's NHS-generated impact stories, and then on the other side, we have NHS supplier-sponsored impact stories. The thing that is always common, though, is that the author is always the NHS staff member who led the change on the ground. That's really important because it needs to be a first-hand experience so that other people can learn from that. The revenues from those sponsored stories is what makes us able to offer BOB completely free for the NHS, obviously with all declarations of interest made clear. BOB is always free for the NHS, and that is a promise. We launched back in April to support around COVID and tell stories of what staff were doing around the COVID pandemic. But we're bringing now Module 1 back on track, which is about general improvement. So that literally could be anything from service redesign to big projects like that, through to small administrative changes that have had a benefit. On the sponsored side of things, we have Module 2, which is around innovation adoption. So that's about profiling optimal use of innovations that have brought benefits to patients and value to the NHS. Module 3 is around collaboration projects. So stories of how public and private sector have come together to make really positive changes for the system and for patients. But BOB is a completely advert-free zone. So we don't have any flashing banner ads and we don't target any sponsored content at staff. It comes up in rich content in search with the rest of the stories on BOB. BOB is a really safe space to tell and then share a story. The first part of that is that we have Nick, who is our dedicated quality manager. Nick has built her career in the NHS and she checks every story before publication. Part of that is looking at things like making sure it's quality content and writing wise, making sure there's no patient identifiable information in there, but also looking for things like whether there should be guidance or policies that haven't been mentioned within a story, making sure that they're pulled out in there. The second step to making sure that Bob is safe is that all stories have to be signed off by a senior team member before they are published on the site. That's really important because you need to make sure that everyone is aware and comfortable with the story being told. And Bob helps you to achieve that approval. And finally, Bob is only accessible to NHS staff and non-commercial organisations that support the NHS. So that includes academic health and science networks, and then also some charities as well. And that's really important because people need to feel comfortable being able to share their stories. So you will note that when you sign up, you need to use your NHS email address. It won't let you use your Gmail. So a bit of a snapshot into our writing engine. Just to note, this has been developed in partnership with NHS staff. So people from right across the system in a variety of roles have helped really build Bob to be what it is now. Our writing engine, it helps to draw out the story of how a change was made. So it unpacks the processes that were taken, the engagement undertaken, and the human factors that really matter. So there are 3 core sections to Bob. The first section is the narrative, and this is a little bit like an executive summary. It uses a storytelling framework to unpack exactly what the project was, but in a quick snapshot. Next is part 1, which is all about the setup and rollout of the project. So everything that happened on the lead up and the actual rollout and all of the nitty-gritty that went into actually making that project happen. Part 2 is the actual impact and the key takeaways from the project. So all of the outcomes and plans for future sustainability and rollout of the project. Each section is broken down into further sub-questions. So as you go through, each one is answered in a concise 100-word limit. You can add links in there, you can upload documents that really enrich your story and provide all of the information that someone would need to be able to do something similar. From a reader's perspective, they can see a video summary of what the project was, and then they can navigate their way through the story and see those answers to each of those questions to really build that picture of all of the small steps that were taken to actually make that project a reality. So that really important how-to. You can choose to either click through and view the story this way, or you can also view the story as a single page. There's always an opportunity to submit a question to the author as well, if there's more information that you need to know. And really importantly, and really critical to actually making Bob as useful as possible to the NHS, is that there's always this inbuilt function to be able to share the story through your networks or via email. All of these stories come together to build a really rich library of content, and this is growing day by day. We're always open to suggestions as well, so if you have ideas of things that you'd like to see on Bob, get in touch. We'd love to have your ideas for new features or content that you would like to see on Bob. As mentioned, it's always been developed in partnership with NHS staff, and we always are welcome new Bob champions. So thanks for listening to this snapshot about Bob. If you'd like to get in touch, we're always all ears. You can find my details on the screen, or you can just search for us on all social media by searching BOB.health. Thanks for listening. Hope to speak to you soon.